Hey there. Ready to jump into this whole bird flu thing. You sent over a bunch of CDC articles, and wow, this isn't your typical bird spreading the flu story.
No, not at all.
We've got dairy cows catching it and even some human cases here in the U.S. That's the thing that really caught my eye, human cases, but the CDC still says the risk is low. How do we make sense of all that?
Yeah, it's a bit of a head scratcher, isn't it? What we're looking at is H5N1, a pretty nasty strain of bird flu. It's been all over the news globally because of how it's impacting wild birds.
Right.
And now it's showing up in poultry farms, even dairy cows here in the US. And yes, there have been confirmed cases in humans,
Yeah.
especially those working closely with these animals.
So it's not just a theoretical risk anymore. The CDC data shows 66 confirmed human cases in the U.S. just since 2024.
Right.
And one of those cases was fatal. That's a bit alarming, especially when you hear bird flu and you think it's something that only affects birds.
Yeah.
What's the deal with this jump to mammals?
Well, what's really interesting is that this virus is showing a real ability to adapt. You can think of it like a lock and key. The virus needs a specific key to unlock and enter a cell, right?
Okay.
Right now, H5N1's key works best for bird cells. But every time it replicates, it's like trying slightly different keys, looking for one that might fit the lock of a human cell.
Interesting.
And the more it spreads among mammals, the more chances it has to kind of stumble upon that right combination.
So the fact that it's now infecting mammals, like those dairy cows you mentioned, means it's getting closer to finding that key that unlocks human cells.
That's the worry. And if a version of H5N1 pops up that can easily transmit between humans, well, that's when we could be in real trouble.
Yeah.
The good news is, for now, there's no evidence of sustained person-to-person spread.
Okay, that's good.
Hmm.
But let's dig into these CDC reports you mentioned. They paint a pretty serious picture, don't they?
They do. We're seeing ongoing outbreaks in dairy cattle across multiple states, with California being a particular hotspot. 36 cases out of the 66 total were reported in California, and most of those were linked to dairy herds.
Wow.
It makes you wonder if the size and concentration of their dairy industry is playing a role. Wild birds are also being affected across a really vast geographical range.
Okay.
Poultry flocks are seeing outbreaks too, though not as widespread as the dairy cow situation.
So it seems like California's dairy industry is taking a real hit from this. And while the CDC hasn't said exactly why California is seeing so many cases, it does make you wonder if it's related to how their dairy farms operate.
Exactly. It's something to think about as we learn more about this virus and how it spreads.
Yeah.
It also highlights the fact that this isn't just a problem for bird watchers and poultry farmers.
Right.
This is something that could potentially impact our milk supply.
And you mentioned poultry farms. The CDC data shows a significant number of those 66 cases were in people working with poultry, especially culling operations.
That's right. Out of the 66 cases, 40 were linked to commercial agriculture, and 23 of those specifically involved poultry farms and culling operations. Wow.
It's a grim reminder of the occupational hazards faced by those working on the front lines of this outbreak.
It really puts those risks into perspective. But what about those other cases? The ones that weren't linked to poultry or dairy cows? The CDC mentions exposures to other animals, but they don't really go into specifics.
That's true. They don't give us much to work with there. 2 cases involved exposure to these other animals, and another 2 had an unknown source of exposure. It's worth remembering, though, that H5N1 has been detected in a whole bunch of mammals,
Right.
from mink and foxes to even seals. So the potential for exposure goes beyond just the usual suspects.
So it's a wider net than we might initially think. And I guess that brings us back to the CDC's recommendations, right? If this virus is popping up in so many different animals, what can people do to protect themselves?
Well, the CDC has been very clear.
Yeah.
Avoid unprotected exposure to infected animals, dead or alive. And that includes avoiding contact with surfaces that might be contaminated.
So it sounds like common sense goes a long way.
It really does. But for those of us who aren't, regularly handling birds or cows, what are some everyday precautions we should be thinking about?
Well, the CDC's got us covered there.
Yeah.
They've got this whole list of protective actions we can all take, even if our closest encounter with a bird is, like, at the park. For starters, they recommend keeping a safe distance from wild birds.
Okay.
Admire them from afar, no petting or feeding.
Right.
And if you find a dead bird, don't touch it.
Yeah.
Report it to, the authorities. It helps them track the spread and take action.
Makes sense.
Yeah.
Better safe than sorry, right? But what if you work with animals?
Yeah.
Especially, ones potentially infected with H5N1. What's the advice there?
The CDC is really clear on that.
Huh?
No unprotected contact with infected animals. Doesn't matter if they're dead or alive.
Right.
That means wearing the right PPE, being really careful about hygiene, and disinfecting surfaces often.
Hmm.
It's all about minimizing that risk of transmission, especially in those high-risk settings like poultry farms or dairy operations.
And speaking of food, what about eating animal products? Is it safe to drink milk or eat meat from, potentially infected animals?
Well, the CDC talks about that directly. Raw milk and anything made with it are off the menu.
Okay.
They could have the virus, so stick to pasteurized milk.
Okay.
As for meat, the good news is that properly handled and cooked poultry and beef are still safe to eat. Thorough cooking takes care of that risk.
All right, so good food safety practices are key here. No raw milk, and make sure your meat is cooked all the way through.
Absolutely.
But, all this talk about H5N1's potential to infect humans
Yeah.
is making me wonder, what would it actually take for this virus to become like a real pandemic, like a serious threat?
Well, that's the big question, isn't it?
Right.
Right now, human-to-human transmission is rare, but it's not impossible.
Right.
We were talking about that lock and key thing before and how the virus is always mutating, trying to find that perfect key for human cells. If it figures that out and starts spreading easily between people, that's when things could get, well, pretty bad.
So it's like a ticking time bomb in a way.
Kind of, yeah.
We're just waiting to see if this virus changes into something that spreads from person to person easily.
In a way, yeah. And that's why the CDC and others are watching H5N1 so closely. They're constantly sequencing the virus's genome, looking for any changes that might make it more easily spread to humans.
Interesting.
It's like a high-stakes detective game, but with genetics.
And are there any vaccines or treatments out there that could help if the worst happens?
Well, there are some H5N1 vaccines,
Okay.
but they're not available to everyone. It's like having a fire extinguisher. You hope you never need it, but it's good to have it just in case.
Right.
These vaccines could be really important if there's a pandemic, but they might need to be updated if a new strain pops up.
So it's good that we have something. What about treatments, though? Are there any medicines that actually work against H5N1?
There are a few antiviral drugs that have shown some promise.
Okay.
They work by stopping the virus from replicating, but how well they work depends on the specific strain and how quickly treatment starts. Early diagnosis and treatment are really important. The sooner you start those antivirals, the better.
So it's a race against time if someone gets infected.
Yeah.
But let's change gears a little. Let's talk about how these outbreaks affect our food supply.
Okay.
Could all of this lead to, like, shortages of poultry or dairy?
It's definitely a concern. Bird flu outbreaks can really mess with the availability and price of things like poultry and eggs.
Right.
When a farm gets hit, they often have to kill the whole flock to stop the virus. That disrupts the supply chain and can lead to those empty shelves we all hate at the store.
Yeah, for sure.
Yeah.
And what about dairy products? With cows getting sick now, could we see milk shortages?
It's possible,
Yeah.
though the number of dairy herds affected is still pretty low.
Okay.
But if this virus keeps spreading in cows, it could affect milk production. We might see prices go up, or even some temporary shortages in some areas.
So this isn't just about bird flu, it's about the stuff we eat every day. It makes you realize how everything is connected.
Absolutely. And it's not just the food supply. These outbreaks have a big economic impact, too.
Yeah, of course.
Think about the costs of killing infected flocks, putting biosecurity measures in place, compensating farmers.
Right.
It adds up, and those costs often get passed on to us.
So higher prices at the grocery store, all because of this tiny little virus.
Pretty much.
It's amazing how something so small can have such a big impact. But all this talk about interconnectedness makes me think about something you mentioned earlier, the One Health concept. Can you remind us what that's all about?
Sure. One Health is a way of looking at health that recognizes how human, animal, and environmental health are all linked.
Okay.
It's understanding that we can't address these issues separately. What affects one affects them all.
Okay, I'm starting to see the bigger picture here. So instead of just focusing on treating diseases in humans, the One Health approach encourages us to look at what might be causing these diseases in the first place.
Exactly. It's about preventing them, not just reacting to them. Exactly. It's about taking a more holistic view. For example, deforestation can force wildlife closer to humans, increasing the risk of viruses, jumping species.
Yeah.
And the way we raise animals for food, crammed together in small spaces, can create perfect conditions for diseases to spread.
Right, so it's like we're setting ourselves up for these outbreaks.
Kinda, yeah.
And this bird flu situation is a big reminder that we need to change how we do things.
It really is. It's a wake-up call to rethink our practices and consider how our actions affect the health of the planet and everyone on it.
So what would that look like? What can we do to, you know, embrace this One Health approach?
There's a lot we can do.
Yeah.
Investing in research to better understand these zoonotic diseases is crucial. We need to promote sustainable agriculture that takes care of animal welfare and reduces disease spread. And of
Mhm.
course, protecting and restoring natural habitats is essential for healthy ecosystems.
It sounds like a lot of work.
It is
But it seems really important if we want to, avoid these outbreaks in the future.
exactly.
But you know what I'm realizing? This isn't just about scientists and like people making policies.
No,
It's about all of us making choices in our daily lives.
you're absolutely right. Embracing that one health approach, it really takes all of us working together.
Yeah.
Individuals, communities, governments, all working towards a healthier world.
So what can we do? As individuals, I mean, it feels kind of overwhelming when you think about how big the problem is.
Yeah, don't get discouraged.
Yeah?
Even small things can help. Supporting sustainable agriculture is a big one.
Okay.
Choosing locally sourced food, maybe eating less meat, and looking for products from farms that actually care about animal welfare can help push the industry in the right direction.
That makes sense. It's like we're voting with our dollars,
Exactly.
supporting businesses that, you know, actually follow those One Health ideas.
Right. And it's not just about what we buy. It's about being informed, being engaged citizens. Stay up to date on the latest research, support policies that protect the environment, and encourage sustainable development, and speak up for change in your communities.
So it's about being smart consumers, informed citizens, and really taking part in making a healthier future for all of us.
That's a great way to put it. Every choice we make matters.
Mhm.
What we eat, what we buy, how we interact with nature, it all has an impact.
Learning about all this, about bird flu and One Health, has really changed how I think about things.
Me too.
It's a reminder that we're all connected,
Absolutely.
and what we do affects everything else.
That's a pretty humbling thought, isn't it? And a call to action.
Yeah.
We can create a better future, but we need to change how we think, be responsible, and work together.
Well, I think we've covered a lot today, from those dairy cows and human cases to like how viruses mutate and how everything's connected.
Yeah, we've been all over the place.
It's been a real journey.
It has. And we've learned that while the risk to the public is still low right now, this is something we need to pay attention to. Staying informed, following the CDC's advice, and really taking that One Health approach are all so important as things develop.
Definitely. And here's something to think about as you keep learning about all this. As we find out more about viruses like H5N1 and how they jump between species, how do we balance protecting human health with the well-being of animals and the environment? It's a tough question, but it's something we all need to consider. Until next time, stay curious and keep those minds engaged.